When you work with people, are they already in a state where they want to leave that easy way out, the short term, disease management, symptom suppression sort of way, or are they still sort of battling that? Because I know in our practice, it's like 50-50, maybe even less, I would say. Like people know they're coming here for something different, but it's still incredibly hard to say, oh man, I got to change everything, really work at and go through some emotional stuff. And, when there's just the pill, and that makes me feel better. What do you find with your practice?
Yeah, most people, by the time they find me, they've been through all of it. They've done the conventional, they've done the alternative, they've done the alternative, and then they finally arrive at this work. And so, so by the time I reach people, it's often they're ready for whatever. They're ready to learn and undertake. And now the actual doing of it, they want it, but the actual doing and the parting ways with even, some things that they're like supplements and things like that they've gotten so used to needing. There is a growing pains. There is further evolution that needs to take place within them in order to achieve that. But I think the desire is there to do whatever it takes to really get to why is my body adapting in this way? Why am I still going through this? Because it's a huge shift in how you operate in the world. And it's a moment to moment thing, because our thought patterns and our perceptions and the way we see ourselves and the world and other people, as we're constantly having thoughts, we're constantly reacting to things, we're constantly kind of unconsciously engaging in reactivating our conflicts. And so that's where the core of the work I do with people, it's awareness. It's like, I've got to be paying attention. How am I responding to this? How am I reacting to this? What am I under the influence of? What ideas am I under the influence of? What old traumas am I under the influence of? What does it look like to actually grow beyond that? Who am I? And, so many conflicts are identity conflicts. Who am I without this disease? Who am I if I leave this job, if I stop doing this thing, if I, stop doing what my family wants me to do, like who will I be? And that's big growing pains with that.
Huge. And it is something that you see people get to where you are. And I understand that going conventional, specialist, something a little alternative, a little more alternative than functional, integrative energy work. And then you finally end up like last chance sort of thing. That's our nickname here at the clinic, Last Chance New York, instead of New York Center for Innovative Medicine. But, we always want to help anyone that's ready to be helped. But, some people are addicted to these things.